From the first local station with news in high definition, this is 9 News Now.
Each year, more than 192,000 American women learn they have breast cancer, and the majority of these women have no family history. But some 5 to 10% of these women do have a hereditary form of the disease, as in the case of Susan Davis. As Susan told me, her breast cancer roots took hold several generations ago.
Oh, geez. Here.
Losing relatives to breast and ovarian cancer became an all too frequent occurrence in Susan Davis's family. It began with her maternal grandmother, Ethel Laird.
She died in 1930, I believe, at the age of 32 after getting breast cancer at age 28.
The cancer legacy passed from Ethel to her 2 daughters. Susan's aunt was diagnosed with breast cancer, but ovarian cancer took her life. Her 2 daughters had breast cancer. One died of the disease.
A picture's worth 1,000 words.
When Susan's mother Marjorie was diagnosed with ovarian cancer the first time in 1992, doctors advised her and her sister Linda to have their ovaries and uteruses removed as a preventive measure.
And I remember thinking, wow, you know, I'm only in my 30s. I can't believe I'm hearing this.
Both sisters had the surgeries. But 10 years later, while undergoing treatment for breast cancer, Susan heard about the BRCA1 gene mutation. She sought genetic testing.
And you're thinking, why me? And then when this came back and you see that you have an 87% risk of getting breast cancer, it was like, no wonder.
It wasn't easy to get that kind of information back, but it was almost a relief.
Now the family's medical tree reveals just how firmly cancer is rooted in 4 generations, both females and males.
This is my son Richard, who tested positive, and this is my daughter Jennifer, who also tested positive.
It was a huge shock.
22-year-old Jennifer has had a benign lump removed. Doctors have suggested she and cousins in her generation have prophylactic surgeries to remove their breast, ovaries, and uteruses.
At the same time, it is a little bit of pressure thinking about the fact that, you know, I need to have all my children before I turn 35.
It's scary, but I also feel that they all have a tool to work with now. They have knowledge that we didn't have years ago. They know what they need to do, and that's something we didn't know.
Susan definitely believes knowledge is power, and a great resource to learn more about hereditary breast cancer is an organization called FacingOurCancerRisk.org. And you can get a link to the site at WUSA9.com. Click on Info to Go. You can see Susan Davis's story again on the Buddy Check 9 page and on my Buddy blog site. And very important, we want to let you know we have a brand new video showing you how to correctly perform a breast self-exam. As you know, the breast self-exam is one of the 3 steps to good breast health. Check it out and share it with your buddy.
Jeez, you know, you just watch that story and you feel for this family, like, why me? Why us?
I know. And then her son found with the BRCA1 mutation, but he was later killed just a few months after that in a motorcycle accident. So, you know, just never know.
Well, it's important to know that information.
Exactly.
It's a great story. Maryland's historic Toll House restaurant, which he is known for its